Hello, good morning. My name is Dr. Ben Newman. I study coronaviruses for a living, and I'm going to try to answer your questions with as much as I can pull from papers and coronavirus conferences that I've been to, the best scientific information that's out there, in other words. All right, our first question is a heck of a long question. Yeah, this is from Lisa. Good morning, Lisa. Yeah. Okay, and the question centers around family visits. All right, and so let's set the stage here. Okay, got a son in Austin, Texas, and girlfriend who work in the same chain of whatever stores of some sort. Oh no, fast food restaurants. There we go. All right, and so I'm going to assume Arby's because I like Arby's. Yeah, I'm sure it's not. We got a husband and daughter live several hours away from the son. Fine. Daughter and the mom are higher risk. Okay, and so haven't gone anywhere except for like getting curbside groceries put in the car. Yeah, which I know sometimes people will come out in the mask and like pull the mask off and say, "Yeah, are you happy with the groceries?" Or they'll drop stuff off at your door and then just hang around outside to make sure that you're happy. Because I don't know, it's a case where customer service kind of runs into good medical guidance. Yeah, and boom, yeah, it's a little problem. Anyway, there's more. Okay, so the husband goes to work 2 days a week, so a little less risk, but in a cubicle in a big room with eight other people, maybe half of which don't wear masks. So, all right, there's some exposure there, yeah, for sure, but hopefully it's okay. And so the question is if the son comes home for a couple of days, what precautions can we take or should we take? Yeah, which is a good question. All right. And the other question down there is should I even worry about it given that my husband is working with unmasked coworkers on a regular basis? Yeah. Which, oh my gosh, but yeah, I don't like it. Yeah, unless you got a door and the door stays shut, you gotta have a mask on, I would say. Um, yeah. So you gotta see your boy, right? That's just the way it is. So the question is how to do this the safest possible way. It also mentions in the question that the rapid COVID test is available in the place, the a local urgent care. That is a good idea. I don't know if you have to fake a cough a little on the way in or whatever, but yeah, whatever you need to do to get a test, I would think for the son and the girlfriend, and probably for yourselves, just take the test and do that a couple of days before the visit so that there is time for the test results to come in before people start getting together. Because the thing is, when your son is in the house, you can wear masks, that's fine, but there are going to be times when I bet you are going to have a meal together because, again, this is your family. Yeah. And being right close to the table, the virus doesn't know when it's mealtime. It doesn't sit down in the corner between rounds. It's always coming out and always spreading to anyone that it can spread to. So testing is going to be the best way. If there's a way to test and then that they wouldn't be at work for maybe 3 days, or that you can set it up in such a way that your husband's day at work, last day at work is going to be a couple of days, enough time to get a test in, then I think there will be a way to have a relatively safe weekend. It's not going to be 100% safe because there's going to be a chance that the tests miss something. But this is the kind of compromise that I think can probably work. As long as everybody involved has had a test, then I think probably that's about as safe as you're going to be. And it doesn't feel like you can break up families. Or rather, I could advise that, but nobody would follow that advice. Yeah, because we're social creatures, and yeah, that's why you have a family, right? It's not so you can not see them. Yeah. So yeah, I think that's the idea. No, definitely don't just give up just because your husband works with, I'm guessing, goofballs, but yeah, maybe people with, maybe they've all got oxygen bottles and severe asthma or something like that. But I'm thinking probably not. Yeah, the important thing is I like what you're doing and don't get COVID fatigue. Yeah, just got to take a minute when nobody else is around. Just relax in a room with your mask off, come back to your happy place, drink a cup of tea or whatever, watch something that makes you happy. And then once you're all grounded and ready again, then that's fine. You can put on the mask, you can go back into the world and deal with stuff. But yeah, this is a lot, and it's a lot for everybody. Don't let it get you down, because we still need you. Yeah, this is Uncle Sam saying the country needs you, and the country needs everybody, including those people at work that aren't wearing their masks. But it needs everybody, and even when we get the vaccine, it's going to be vaccines and masks. Otherwise, this thing is not going to go down. It's just going to keep lingering at a really high rate, and that's bad news. So, yeah. All right. Stay safe. I like what you're doing. I like the way you're thinking. And, yeah, I hope you have a nice visit, with your son. Thanks very much. This has been Ask Dr. Ben.